Good evening, this is Dr. Jha here. So, thanks for joining the Facebook Live. So we have been doing series of Facebook Live for last few weeks time. So today, I think it just provoked her because you won't believe it, I just seen a patient. Unfortunate death in somebody in Bihar, which is around 1,000 kilometers away from here. It took the car, a Scorpio car, and drove down to Bihar overnight. And unfortunate, some family, a young death, and he came back almost very next day. And he's coming back with a foot ulcer on his second toe. He's a young man, type 2 diabetes. So the question is that why he had a foot ulcer and why he should have not driven without shoes or chappal or anything at all. So the question is that he never felt the sensation. He realized there was a big ulcer, which you can see visibly from 10 meters, but he never felt it. There was no pain. So what I'm trying to say is that खुदा ने हमें pain response दिया है ताकि हम उससे act करें. Now, if I put a pinprick here, I would try to remove it. That's the natural God response. So what happens in diabetes, if you imagine that's my feet there, my sensation of the sole is less. And even if I'm putting into a hot water or putting it to a metal sensation or putting it constantly rubbing on the stone, I would not feel it. And I'll keep rubbing and I'll create an ulcer. And I create an ulcer and then I will not have a pain, which will say, look, अच्छी बात है डॉक्टर साहब, पेन नहीं हो रही है. लेकिन पेन होना is a good response, so that we know कि आपको डेंटल पेन होता है, नहीं तो सड़ जाएगा, आपको मालूम ही नहीं चलेगा. डेंटल एक आता है तभी आप डेंटिस्ट के पास जाते हैं. चेस्ट पेन होता है तो कार्डियोलॉजिस्ट के पास जाते हैं. तो पेन रिस्पॉन्स इज अ गुड रिस्पॉन्स. एंड डायबिटीज में पेन सेंसेशन कम होते हैं, इसलिए भी हम लोग साइलेंट हार्ट अटैक बोलते हैं. तो आज की चर्चा हम लोग डायबिटीज फुट डिजीज पे करेंगे और ये करेंगे कि डायबिटीज फुट डिजीज क्यों होती है और डायबिटीज फुट डिजीज से बचने के लिए क्या करना चाहिए और न्यूरोपैथिक क्यों है. I'm very proud to announce my colleague, Dr. Nandini, who is a consultant in diabetes. She's working with me 5 years' time, and she'll be able to educate you and tell you about diabetes. And I've got on my right another young girl, Sakshee. She's going to talk about diabetes, foot education also, and as well as a bit of diet about it. You might have seen Sakshee before. I think Nandini you are seeing first time. So I'm just trying to introduce my team, and they can take on, and they shall be happy to take on any questions. If there are any questions which, if you want any help, I'll be able to support them. So back to Dr. Nandini Chabbra.
Thank you, sir. Thank you. Good evening, everyone. I'm Dr. Nandini Chabbra, and I'm joined here by Ms. Sakshee Dhawan, who is a diabetes educator and a nutritionist. So together we will be talking about the causes, मतलब causes, pathophysiology, I mean to say कि क्यों होती है डायबिटीज की फुट डिजीज, फुट अल्सर क्यों हो जाते हैं डायबिटीज में, और साक्षी आपको कुछ टिप्स बताएंगी कि कैसे हमें अपने पैरों को हेल्दी रखना है फॉर इन द लॉन्ग टर्म. As a diabetic, as a long-term diabetic, we have to take care of our feet as we take care of our face. Am I right? So it is very important because sometimes it is the feet which get ignored, which should not happen. Okay, so I will switch to one of our presentations that we have so that we can easily go through certain things. So diabetic foot by definition is any infection involving the foot in a patient with diabetes originating in a chronic or acute injury to the soft tissues of the foot with evidence of pre-existing neuropathy or ischemia, and is a major cause of amputations, approximately 70%, and it accounts for 25% of admissions in the hospital. मतलब कि जब क्रॉनिकली हमारे पैरों की नर्व्स, हमारे पैरों की ब्लड सप्लाई कॉम्प्रोमाइज्ड है या कम हुई है, तो क्रॉनिकली बहुत धीरे धीरे बनने वाले अल्सर या इंजरी एक बहुत ना ठीक होने वाले अल्सर में बदल सकते हैं, जो कि बहुत नुकसानदायक हो सकते हैं, और इतना ज़्यादा स्प्रेड हो सकता है उसका कि हमें वो पार्ट काटने की ज़रूरत पड़ सकती है. दैट इज़ व्हाट इज़ कॉल्ड एम्पुटेशन. So, by classification, the etiological classification would be neuropathic foot. Neuropathy is the dominant cause of diabetic foot ulcers, with infection or without infection. So, अगर वो फुट अल्सर ऐसा है जिसमें कि ऊपर से और बैक्टीरियल इन्फेक्शन हो गया है, दैट इज इवन मोर डेंजरस, and it can lead to a long-term hospitalization, long-term use of antibiotics, and difficult to heal as well. And the other cause can be neuroischemic foot ulcer. इसमें हमारी vessels भी equally involved होती हैं as our nerves. So the vascular disease is dominant here, and this can also happen with infection and without infection. So there's a long classification for diabetic foot ulcers: superficial ulcers, or ulcers extending to the ligaments, tendons, joints; deep ulcers with abscesses, osteomyelitis. It is the case where the bone is involved. Even it is that deep that the bone gets involved. And sometimes the vascular supply is so compromised that it forms a gangrene. That is, no blood is reaching, that big part becomes black, and ultimately it needs to be like chopped off or amputated. I mean, we have to use such words, but yes. So what is neuropathy? Sensory neuropathy means loss of pain sensation, unnoticed trauma, thermal, chemical, or mechanical. Progression of lesions is unchecked. That is, as Dr. Jha initially said, that we do not feel the pain of that particular trauma, whether it is because of something hot, something chemical, or some mechanical. So we do not feel that pain, and then there is progression of that lesion. Then there is a callus formation. That is, you can see that the skin becomes very hard and whitish in color. It's almost dead skin. And then the tissue gets necrosed, and there is damage beneath the callus. Ultimately, there is development of cavities, which is filled with serous fluids, and there is eruption of into the surface, which results into the ulcer formation. So basically, sensation is lost. अगर हमें यहाँ पे thermal pain या chemical pain या ill-fitting shoe, which is the most common cause of a diabetic foot ulcer, is sometimes people in these days that people are ordering footwear online, and they say कि हमने जूता online मंगाया, जो कि थोड़ा सा टाइट था, हमने फिर भी पहन लिया, और उसमें अल्सर, थोड़ा सा पैर में दर्द हो गया, and then they put it in hot water to relieve the pain, and all that combined brings into this kind of mechanical and thermal trauma on top of the neuropathy that was already existing, and causes the further damage, as I said. Secondly, then motor neuropathy. Motor neuropathy basically occurs because of the weakness and wasting of the small muscles of the foot. So what causes is, it causes foot deformity. Naturally, हमारा पैर जो है उसमें naturally pressure points designed हैं, जो कि हमारा weight लेने के लिए design होते हैं. डायबिटीज पेशेंट्स में जब छोटी छोटी मसल्स जो हैं हमारे पैर की, वो जब उसमें वेस्टिंग हो जाती है, वीकनेस हो जाती है, तो वो प्रेशर पॉइंट्स चेंज हो जाते हैं और क्लॉ फुट हो जाता है. तो उसकी वजह से वो जो नेचुरल एरियाज थे प्रेशर लेने के, उसकी बजाय डिफरेंट एरियाज बन जाते हैं प्रेशर लेने के. दैट कॉजेज एबनॉर्मेलिटी इन द गेट एंड अल्टीमेटली अल्सरेशन, क्योंकि वो नेचुरली डिजाइन ही नहीं हुए थे प्रेशर लेने के लिए, लेकिन अब वेस्टिंग ऑफ मसल्स की वजह से उस पे प्रेशर आ रहा है. Then there is autonomic neuropathy, जिसमें कि as we see there is decreased sweating, the skin becomes dry and brittle, there are fissures and cracks, and there is secondary infection over it, and ultimately ulcerations. So in the end we will discuss certain things, how to take care of all these things as a diabetic, so to prevent any such neuropathy side effects from happening. So this is what I was talking about, that these are the normal pressure points on the foot. There's a normal fat pad which is God has created for us. But what happens when the muscles are weak, the pressure points change and the bone is directly hitting onto the ground. And that causes further damage to the underlying skin and calluses form. We call it hammer toe or claw foot. Now the vasculopathy. In brief, it is a decreased local blood flow, which causes decreased oxygen supply to that area, and ultimately decreased nutrition of that part. So in diabetes, there are macro and micro angiopathies. So macro angiopathies mean large vessels and micro means small vessels. So what happens is this causes delayed wound healing, because there is poor antibiotic penetration and poor blood flow to that area. ऐसे समझना है हमें कि जब हमारी नाड़ियाँ पतली हो गई हैं तो वहाँ तक ब्लड ही नहीं जा रहा है. तो जिस एरिया को हमें और ज़्यादा ब्लड देना है, क्योंकि वो पार्ट हेल्दी नहीं है, उसमें अल्सर हो गया है, तो वो और ज़्यादा टाइम लगता है हील होने में. एंटीबायोटिक जो कि हम इंट्रावीनसली देते हैं पेशेंट्स को, वो और देर में पहुंचती है. एंड vasculopathies are more prominent in smokers. Smoking is a very important cause of vasculitis, मतलब कि वेसल की अंदर की लाइनिंग को वो डैमेज कर देती हैं और ब्लड फ्लो फर्दर डिक्रीज हो जाता है. एंड then there is immune dysfunction, matlab immunity is already disturbed in a diabetic patient, and because of lack of blood supply it is further disturbed. So there's decreased white cell migration, decreased phagocytosis, that is the dead cells are not being taken up by the blood and being removed. There is decreased intracellular killing, that is the dead cells are not being cleared off, and intracellular जो antioxidants पहुंचने चाहिए थे वो नहीं पहुंच रहे हैं. There are more of oxidant radicals in this system, and that leads to decreased chemotaxis, that is attracting the antibodies and the healing elements is further decreased. So basically diabetic foot ulcer disease is a complex interplay of several factors, as we talked: motor neuropathy, sensory neuropathy, autonomic neuropathy, vasculopathy, and immune dysfunction. So all this when combines makes our the diabetic foot ulcer very difficult to heal. So the best thing is to prevent these things, firstly by keeping our diabetes very well under control, and secondly by doing good foot care, which shortly Sakshee will be talking. So we have, I think, already covered these things, that what are the intrinsic factors and what are the extrinsic factors. Extrinsic factors, yes, that walking barefoot should not be done, inappropriate footwear should not be worn, falls and accidents should be avoided, objects inside the shoe, the diabetics should always check their shoes regularly, and there should be a normal activity level which should be maintained. That is what just Dr. Jha had initially briefed us, that that one of his patients who he's seen today, he drove thousands of kilometers barefoot and didn't realize the pain. So walking barefoot is really dangerous thing in diabetics. These are a few characteristics about differentiating between neuropathic foot and an ischemic foot. I don't think we need to go into much details about them. What is more important here is the tips and things which we need to take. I'll just go through if we just... Yeah, we need to keep our glycemic control in good targets. And who are the at-risk patients? Who are having poor glycemic control, who have peripheral neuropathy, who are already cigarette smokers, who already have foot deformities, or have pre-existing calluses or corns, who have peripheral arterial disease, that is their blood supply to the end parts of the foot is compromised, history of foot ulcers, or if they already have any amputations in the past, if they already have visual impairments. This means that the very tiny vessels in the body are already affected. So this is a preliminary sign that if those thin vessels that are behind our eye, which we call in the retina, if they are already impaired, that means further the vessels in the kidney and the foot would also be affected, and we should be more careful. So my recommendations by RDA, American Diabetes Association 2017 are that perform a comprehensive foot evaluation at least annually to identify risks for ulcers and amputations. So each time you visit your doctor, he should be examining your foot regularly, and all patients should be inspecting their feet at every visit, and we should obtain a proper history about ulceration, amputation, cigarette smoking, retinopathy, and patients should be aware of the pain, the burning sensation, or feeling numb, or feeling if they're having leg fatigue or claudication. Claudication is an important sign of vascular disease, and I would explain it that if on starting walking, if you start feeling the pain in your calf muscles after about few steps, and that pain is relieved after resting for 5 to 10 minutes, this is called claudication. This is an intermittent pain which is felt in the calf muscles and is an important sign of vascular diseases. That is, the blood supply to the muscles is being compromised, and it should not be ignored. You should seek the advice of a doctor as soon as possible. I think Sakshee would take this, that how we should examine the skin and how you should take care of your foot. This is about the monofilament, the 10-gram monofilament, which usually all of us do at the OPD visits. We should see whether it is bending, and the patient should feel the pain before it bends. So what are the areas of examination? These are the pressure points which should be examined at each visit.
The tips are important.
So the tips are important.
Now, coming on to the tips on how to take care of your feet. So there are a few tips that we like to focus upon, starting with checking of your feet every day. So checking of your feet, I'll talk about each topic in detail. Next, coming on to washing of your feet every day, then the smoothing of corns and calicus gently, trimming of your toenails straight across instead of cutting deep into the toenails, then wearing your shoes and socks at all the times, and protecting your feet from extreme temperatures of hot as well as cold, keeping the blood flow towards your feet, and getting a foot check done at every healthcare visit. So starting with the first one, that is checking of your feet. You must check your feet every day just to avoid any problem or delaying of the complications. So the best way is to remember and check your feet at evening while you are taking off your shoes. It's important to check in between your toenails just to make sure that there's no fungal infection growing inside. So there are some things that you should look for. So the includes cuts or sores or any red spots, any swelling or fluid blisters which are there, or any ingrown toenails which are there, or the edges of your toenails which are growing deep into your skin. You must cut them down. Also, you must look in for plantar warts, which are flesh-colored growths on the bottom of your feet. So this is how one can check their feet. If they have problem in bending, they can put down a mirror and then see through the mirror if there is any corns or if there is any peeling of the skin is there. So coming on to the next, which is washing of your feet every day. It's a basic hygienic practice that we must follow. So you must follow your wash your feet every day with soap and warm water. But make sure that the temperature is not at extreme. So no hot water should be used. You must test the water beforehand before using it directly on your feet.
With the hand.
With your hand, exactly. So, and after washing your feet, you must dry it completely. So you can use some talcum powder or cornstarch in between your toenails to make sure that there is no moisture left inside. As the moisture, if any moisture stays, it will cause the infections to grow. Then smoothing of your corns and calicles gently. There are thick patches of skin called as corns and calicles, which we might have observed sometime. And we must talk to our doctors about how to take care. And we must not rub and scrap the skin off. And instead, we should use petroleum jellies on the top and bottom of our feet to keep it smooth. We must not put any lotions in between the toes, as it will again put in the moisture. Cutting and rubbing vigorously with any nail filer, it will lead to damage of the skin and lead to more skin infections. Trimming of your toenails straight across. The method of cutting across is important, as the corners of the toenails should not be cutting deep into your skin. Gently smoothing each nail with a non-sharp nail file is beneficial. Trimming of this way will prevent cutting of your skin and will keep the nails from growing inside the skin. So this image shows how you should cut straight and not inside the skin. Wearing your shoes and socks all times. This is the most important tip, as you must wear your shoes and socks at all times. You should not walk barefoot even if you are indoors. It's important, as you might step on something which might hurt you and you don't even feel it. You must always check your shoes before putting them on, just to make sure there is no pebbles or there's no stone inside. And you must make sure that you wear socks and stockings or nylons, and that will keep from getting your blisters or sores. You must keep your socks clean and lightly padded, and make sure that they fit you well. Then protecting your feet from hot and cold, as explained by Dr. Nandini also, that we should not use extreme temperatures, as heat and cold sensations might be lost in patients with long-standing diabetes. Then coming on to keeping the blood flowing towards your feet, we must try following tips to improve the blood flow towards our feet. You must keep your feet up while you're sitting. You must keep your ankles moving up and down and help the blood flow towards your legs and feet. You must not wear tight stockings or elastic stockings, and do not use elastic rubbers to keep your loose socks fitting in. Be more physically active, involved in activities such as walking, dancing, yoga, or stretching, as it improves the blood flow. Smoking is one important factor that you must all focus and should stop smoking. So this is how the stockings should be worn. The last and most important is a visit to your healthcare professional. At least I would like to correct this statement, and we should always get a foot examination done on every visit that we are going to our healthcare professional. And we must observe that if there is any change in shape of your feet, or if there is any loss of sensation, we must discuss it with our healthcare professional. So what are the things that you must discuss with your doctor? If you're feeling any pain in your legs, or if there is any cramping in your thighs, in your buttocks, or in your calf muscles during physical activity, or in your daily routine while you're going up and down the stairs, or you're traveling throughout the day, then you must discuss it. If you feel any tingling sensation, burning, or pain in your feet, or you feel there is any loss of sensations in the ability of heat and cold, if you have any change in your feet over the period of time, or there is any loss of hair in your toes, legs, or lower legs, if you feel that there are skin that is getting cracked or dried on your feet, you must discuss it and look for a proper solution. In any fungal infections which can be in between your toes or the bottom, or if the skin is peeling off, or any unhealing ulcers or blisters are there, you must discuss and get a remedial action done immediately. So some of the key take-home messages our first and foremost is to stop smoking, as smoking impairs the blood flow towards our feet, and we are not taking care of our feet, and smoking, then it's very bad. We must keep a check on our blood sugar levels, and we must always check and keep our blood sugars in target. The blood pressure should always be in check. The foot examination should be done every visit, not every year, but every visit. Self-foot examination should be done every day while taking off your shoes. So, that is all on our slides.
Thank you so much, everyone. And we are happy to answer
Your queries.
any questions, any queries.
My grandfather is diabetic patient. He can't do exercise due to weakness. Please suggest some diet methods and other alternatives that should be helpful. Okay, so Kashish, for this, I would like to answer you that, for any diabetic patient, it's generally 20 to 30 minutes throughout the day that you should practice some physical activity. It's not necessary that he is going to the park and doing all the physical activity throughout, but we can start with like 10 to 15 minutes post meals. And for the dietary methods, we have already discussed earlier in other live sessions with Manju ma'am, and everyone has discussed in the videos that we must follow a high fiber diet. But to improve the blood flow, it's very important to include some kind of physical activity. It can be anything like the yoga or a stretching or any light kind of physical activity can be included into the daily routine.
Yeah, so Kashish, if your grandfather is not able to get up, you can even do passive exercises. For example, like physiotherapist can help, and he can guide that you can keep moving his limbs while he's lying down. The upper limbs and the lower limbs can be moved by someone. These are called passive exercises, which can also be like a starting point. And then he can slowly, once the muscle strength is built up, and he can slowly start walking a little bit. Yeah.
What can be the main cause of diabetic foot ulcers?
So, Rahul, as we discussed, that the causes can be loss in the nerve sensation, which is neuropathic. Then there can be motor neuropathy. In that can be motor neuropathy, or can be autonomic neuropathy, or sensory. मतलब सेंसेशन नहीं आ रहा है पैर के अंदर, या फिर मसल स्ट्रेंथ वीक हो गया है, या जो ऑटोनॉमिक नर्व्स होती हैं which help in sweating etc., they are not able to take the sensation, and the foot is dry and is not able to keep the skin hydrated well, and that can all cause neuropathies. Lastly, the vascular causes can be there, that is the blood supply is less. Okay. Next, Sakshee.
It is suggested that a diabetic person should not soak their foot into warm water. Please explain. Yes, so one must not keep soaked their feet, as sometimes they might not feel that it's the temperature and the peeling of the skin is there. So it can lead to damage of the skin and to the sensitive inner tissues. So the soaking should not be done, but cleaning of the feet is necessary. So make sure that you are cleaning with normal water and soap. That is beneficial. That's it. And plus, using of moisturizer is important.
So as Sakshee already said in her tips, that when you want to soak your feet in water, or even wash your feet with warm water, you should not check the temperature with feet, because we in long-term diabetics, we doubt that there might be neuropathy, and you may not feel the exact temperature of that water. So always check with your hands the temperature of the water that you're going to wash with. Then soak your feet or wash it. It's not advisable to soak for a long time anyways. Next. Okay. Yeah, hi Ashima. So you should be in touch with your diabetologist or endocrinologist regularly, and if need be, you should be visiting a plastic surgeon or someone who is specialized in diabetic foot diseases in your locality. So her sugars should be well under control, and if the foot sores are really causing so much of problem, I think you need urgent medical help.
Yes.
Yes.
Yes, it can be symptoms, and you must consult your endocrinologist and seek for the support.
Yeah. Yes, these symptoms should be taken seriously. What exercises should you perform if you have ulcers? See, if you have diabetic foot ulcers, we recommend offloading shoes, special shoes which are designed for such patients, and then they can perform walking exercises and things like that. So first of all, you should be taking a proper shoe, which is called an offloading shoe, which takes away the weight from the pressure point and changes the pressure points in a different way. So, which can really help.
Padding is important to keep the ulcers from further damage.
Yes.
So it's really good that you have a proper footwear while you are exercising.
And especially if the ulcer is fresh, I mean, if it is infected or something, then you should be waiting for it for proper healing and then go ahead with the exercises. Healing.
It can only occur if the proper precautions are not taken. Precautions needed.
Okay. Mr. Rajkumar, you mean to say that the area that has been drained, that means the skin that is been taken off, kya wo wapas aayega? Is that your question?
But otherwise, if it has already been operated, you must consult the plastic surgeon rather than going in.
And if the blood supply to that area is good, then there are chances that it will heal properly. वो वापस आ सकता है skin उस पे. नहीं तो अगर बड़ा area होता है, then the plastic surgeons do skin grafting over it to cover it, and then it heals well. Yes, Sakshee, you should answer. Yes.
Yes.
Yes, you can.
Okay. In different way to take him to the hospital and then get him checked.
Yes. And you haven't mentioned, is your roommate a diabetic? So if he's a diabetic, then it's further important. What food habits are preferred with diabetic persons having ulcers?
Yes. So anybody who is having foot ulcers, that means his diabetes is uncontrolled, and therefore he must be strict on diet and must include high fiber food in his diet. So salads and fruits and raw fruits and vegetables is one must thing, and plus shifting all to whole foods, whole grains and whole pulses is one important tip. Plus hydration is also important. So along with the high fiber diet, if the fluid intake is not good, it's of no use. And plus again, some amount of physical activity is needed. Diabetes.
So diabetics should always wear, as she said, cotton padded socks, and the footwear which they use should be comfortable. It should be properly fitting. it shouldn't be like crunching their toes or ill-fitting shoe. That is that is absolutely a no-no. And wearing the nylon socks were pretty long can cause excessive sweating, especially in hot weather like India, and that can cause excessive moisture between the toes, which can cause further fungal infections.
So any material which is cotton made, or there are special socks which are available for diabetic patients, you can opt for that as well.
Yeah, and many footwear nowadays are available which are aerated. And they are made of such material that they advertise in such a way that there's airflow through the footwear. So that is a good thing, and it helps in keeping your feet healthier. Any further questions, or we can even further take the chat questions if they come later.